Policy Week for us is an Africa forum where we come to share what we've learned, experiences and best practice, and also just to know where are we in terms of the current theme and what is new in the advocacy scene.
It's a great forum because it seeks to bring together a lot of like-minded persons within the drug policy space, and also to bring diverse views to one umbrella where we can share ideas, we can share knowledge, and be able to build a stronger force in terms of the advocacy within the continent for reform. Because if you look at Africa generally, the reform is quite slow. The reception in terms of the paradigm shift is a bit very slow with governments, because over the years we've seen the attitude of governments is basically about punishing people, arresting people, seizing crops and telling us what quantity of tons of drugs we have been able to seize, and that's how governments over the continent have touted their success in the fight against drugs within the region. And so for me as an advocate, I believe this forum, it's an opportunity to see how we can structure our messages, how to be able to engage policymakers with the evidence to be able to see that change across the continent.
It's a good platform to really just get an idea of what's happening within Africa, and I think it's a great platform to have to learn best practices and see how we can start integrating young people's involvement in drug policy discussions. And I think it's like one of the first of its kind, where usually it's been about a global perspective, but I think it's really good to start putting or highlighting the voice of African best practices.
There's a lot of things that authorities need to address. One is funding. Africa needs to fund its people, and harm reduction is healthcare. So we need to look into funding. How can specific Africa governments put aside money from the exchequer to fund harm reduction programs? How can the health sector start preparing to treat people with substance use disorders at the primary healthcare clinic? How can healthcare workers begin gearing up themselves to be able to take the community of people who use drugs through the healthcare system? So I think because we have been reliant on donor funding for a long time, and that is going down, we are putting the community of people who use drugs in a very precarious situation. And we need to push governments to fund harm reduction.
It's unfortunate that we're not seeing young people at the table, and so it would be good to not only have solutions for young people, but to also involve them in coming up with these solutions. So yeah, just making sure that the approaches are more integrated, that services actually have provision for young people in them.
When I began this work a few years, 10 plus years ago, it was very difficult to speak to policymakers about drugs and drug users because of the criminalization. We are still facing criminalization in our laws, but at least these days we can have policy dialogue platforms where we talk to our leaders about harm reduction. We have had governments come forth to participate in meetings where we do harm reduction. So in terms of awareness, yes, we have moved. In terms of service delivery, yes, we have moved. But in terms of drug policy reform, not yet. We still need to really go down and focus on public health approach and human rights approach for people who use drugs.
My message for our authorities, especially governments and then key policymakers, is that we need to begin to allow science, evidence, to drive our policies in this continent. Because if you look at many of our governments and how they react to the issues of drugs, it is basically about security driven. It is about more of a reactionary response to drug policy. But rather, I believe that if we allow science to drive the process, we will be able to see that the drug issue is not just a security issue. It's a multifaceted issue that requires multidisciplinary actions to be able to address the issue. It is a health issue, it's a human rights issue, it's a development issue, it's a social justice issue. And so to address all these things, you need various strategies to address all these issues. And if you focus on one direction, you're bound to fail. And that is why we are failing with the war on drugs.